The punchline is lifestyle matters more than anything. I know that there's a lot of like hardliners that are like, if you say you don't have time, then it's just not a priority. But the reality is let's break down the 24-hour time pie. We end up taking from the pieces of the pie that will not hold us accountable for that. We won't take it from the 8-hour workday because we'll get fired.
Right.
But we take it from sleep. We take it from meal preparation. We take it from exercise or the commute to the gym. We take it from all the things that we know we need. And this is all, the time pie is all without a kid. Add a kid in there. Now you have school pickups and sports. And I was a career woman. I want every woman that wants a career to have a career. But when you try to do it all, we only have 24 hours. So I'm really glad that I had those 40 years to figure out who I was, what I wanted, have all the experiences. I traveled all the time. And now I lost my career and I was worried about that, but I have never been more content, ever. I have never been more fulfilled, ever.
All right, everybody, welcome back to the Dr. Bradley Campbell podcast. We're having authentic conversations with people like Dr. Angela Lucterhand, who is extremely authentic and very truthful and honest, and I think tells people what they need to hear sometimes, not just what they want to hear, which is great. And we were just talking about this before we started, but I'd love for you, Angela, just to introduce yourself and how you came to be in this current form of yourself.
Yeah, so Dr. Angela, many of you may follow me online, I don't know, but Dr. Angela Lucterhand is my handle on Instagram. And this whole like Instagram thing, which is how we kind of met, has not been my goal, and I have no idea how we ended up here. But I got my doctorate knowing the same thing that most doctors want to do is help people, right? You want to make a change in the world. You want to have a positive influence on people. You know that there's answers. I always did know that I was going into it with the idea that I wanted lifestyle medicine to be a part of my therapeutic interventions. At the time when I entered school, chiropractic was actually probably the most respected and well-known primary care physician or portal of entry, right? So there's a lot of different types of clinical degrees that you can get that you need a referral from another physician to do some health work with someone, right? So I wanted to be a primary care provider in that sense, but I always knew that it was going to be a functional medicine angle and that it was going to include lifestyle intervention. Now, along my journey there, I kind of didn't realize that I would end up being a chiropractor because I thought I was going to be a medical doctor until the moment came when you're like, oh, I have to prescribe medications or be on call all the time. Or it just was a misalignment with who I was and the way I wanted to live my life and practice. And so I actually went into the Peace Corps. So I lived in Mali, West Africa as a health education specialist for a period of time. And so I think one of the benefits I had during that time was seeing an entirely different culture, not only socioeconomic status wise, because it was a third world country, but just an entirely different set of views on how people live life. What are the ailments that they deal with? What are the strategies and interventions that are available or used? Because they don't often have the same strategies and interventions that we have. We have tons of medications and surgeries, but we are one of the worst in terms of health in the world, right? So I think that gave me a lot of insight as to what do you do with the bare bones and what does acute infectious disease look like as opposed to chronic disease. So at the same time that I was there, one of my best friends from college got cancer for the second time. So it was a lot of questions going on in my mind, like, okay, these people that I'm serving in West Africa might get hit by a moto and need to be like carted somewhere for emergency surgery for trauma, or they might get an infection that puts them down a really bad path that antibiotics are a lifesaver for that person. But then on the other hand, across the ocean, where I'm about to go back and practice, we don't have much of that going on. What we have is a ton of chronic disease stealing people's quality of life, just keeping them from being able to live the life that they want to live. Because I don't think health is actually the end goal. I'm a doctor, but I sort of equate myself to like a financial planner, if you will. The idea that I want to die the healthiest person on the planet is not my goal. And I don't want it to be anybody's goal that I work with. You will be a very unhappy, lonely person sitting in your box trying to eat everything perfect, not be exposed to any toxins, have no exposure to anyone. I mean, it would be crazy. So it's how do you use health to leverage the life in your years and the joy in your years and things like that. So when I got back, I went to chiropractic school, got my doctorate, started practicing functional medicine and physical therapy on top of chiropractic straight out of the gate. I never intended on being an autoimmune specialist, but when an autoimmune patient walk through your door and it's like over and over and over again, and you're seeing the pattern that they're all on these immunosuppressants and they're all told that there's nothing they can do, you become the investigator, you become the doctor, which is the teacher, right? And so it was a big learning process on my part. What is available out there? Because this can't be the only solution. This doesn't make biological sense. We rest a lot of our questions on what we believe. And I think a lot of chiropractors are instilled with the idea that we have an innate intelligence. That means your body wants to be healthy, and we all exist in an ecosystem that is sort of synergistic with each other. And I think the medical paradigm operates very differently. So when you ask the questions within that healthy paradigm, you start asking, why would the body do this? Why would the terrain do this? Why would the ecosystem do this? There's usually a reason behind it. So my very first patient that I treated with functional medicine was a lupus patient. And one of the local magazines picked up her story, and it was like wildfire in a small community. Like, oh my gosh, you can actually reverse an autoimmune disease. Like, this is unheard of. But really, it's not unheard of anymore, probably. But at that time, it was probably 15 years ago or so. And so then you just had a line of autoimmune patients at your door. And that's kind of where I got my niche in autoimmunity. And I love that space because there is no cure that is offered to them in the medical paradigm. So you see not only patients that are needing help, but that you can help when they've been told that there is no help. And so you're not trying to have that like competing conversation. And I think that that's very similar to the Alzheimer's conversation right now, right? There's 146 drugs that have not been approved because they just don't work, because chronic disease is multifactorial, and you try to, isolate one element and treat it with a drug, and you're not going to get a good outcome, period. End of story. So I like to approach things from sort of a let's ask better questions first. And I know we're here to talk about hormones, and I actually I wouldn't consider myself a hormone expert, but my next step in my journey was to work for a functional medicine company that teaches physicians. So I was the clinical education director at a functional medicine company, and that allowed me to step out of practice after a few years and just do more online education while teaching doctors and learning from thousands of functional medicine doctors at the top of their game. What are they doing in practice? What are they seeing that's working? And that was a whole nother set of like tools that I was never exposed to because it wasn't in my scope of practice or therapeutic wheelhouse, etc. And I'm a voracious reader. I love just gathering information, sifting it down to what is the actionable item? What does this mean? What can we do about it? And I'll tell you, at the end of the day, this is the punchline. I don't care what expert you're listening to. I don't care what chronic disease you have. If you do the things that are meant to make a healthy human healthy, it corrects everything that you would walk into the office for the most part.
Yep.
If you restore cellular health, you reverse autoimmunity, you reverse dementia, you have fertility. These are all expressions of a healthy human body. And we isolate them like, oh, there's got to be a certain solution for this one and a certain solution for that one. And it's not the case. Every
Yep.
expert will present it through the lens in which they're an expert in. But the bottom line is, every one of them is going to tell you, I get success because I do diet, movement, mental and emotional health, connection, all the same theories of like the blue zones and things like that too.
Yeah.
So I don't know how much gold nuggets we're going to get here today,
That's
but
already a lot of gold nuggets.
that's the punchline. The punchline is lifestyle matters more than anything. And you do that 99% of your day, and your doctor does maybe less than 1% of your day's worth of input into your life. So I think we need to step over the idea. And I think our audiences probably have gotten rid of the idea that doctor knows best, and they've sort of investigated and realized, wow, there is a lot that I can do. And with technology, I can find a lot of answers myself too. I just think that a lot of those answers are still hard things because we've
Yeah.
expected a human being to exist in a modern world that was not set up for the way human beings are supposed to live and be healthy. That is probably the bottom line. I don't know about you. I know you're getting like 1,000,000 degrees, but if I could go back like right now, I would probably do something in like environmental medicine where
Yeah.
you could have more impact, or politics or something where you could have more impact on what is in the environment, the food. Because if you made the choices easy and you made the exposures to toxins non-existent, half of our doctors wouldn't have jobs,
Yeah,
or at least not for
exactly.
chronic disease type stuff, right? So I
No.
think in some ways I'm a middleman between the consumer making or patient making a decision for themselves, but also having to work within the confines of things that I know I can't change. I can't
For
change
sure.
people's access to things. I can't change food subsidies so things are cheaper if they're just processed and made from corn. You know, I can't change some of
Right.
those things. So there's definitely some costs
For sure.
to,
I've definitely thought about that too. It's like I've thought about like, well, maybe I need to go back and like do law school or do politics because like to actually make systemic change for the whole country, you have to do some of those bigger picture steps, I think. Because they don't have access to buying all of the trans fats. They don't have access to buying all of the over processed foods. I think that's what Mark Hyman has done a little bit in the last couple of years. He's like tried to make more, change in government and like lobbying. And it's kind of weird, but I feel like the people who are lobbying for what's actually good for us is kind of what's going to end up saving more people long term.
yeah. I mean, I don't know if you saw that there's a documentary on Netflix and it's about twins. And I won't really go into it because there's some things about it that aren't great. There are some things that are very interesting about it. And one of the things they do is try to determine whether or not an omnivore diet or a vegan diet is best for these people, and they're identical twins. So, right, you're taking out all the variables usually that we have within a study population. And the first thing they did was give them the meals. Now, there were some issues with it, but they gave them the meals for a certain period of time because an inherent fault in the way that we study with nutrition is people are notorious for forgetting what they ate. They don't stick to the things. Unless you put them in a bubble, it's very difficult. So they sort of tried to streamline that process by giving them pre-made meals that fit the criteria in which they wanted them to adhere to. And then they took those meals away and they had to cook for themselves. So it was an interesting experiment for me to watch, just because I love the research and I love information, but it's totally different than a patient sitting in front of you. You have to meet patients where they are. And I can tell you to do this, that, and the other. But if you can't do them, or you can't afford them, or it's impossible, then my advice is worth nothing. Right? So it was interesting to see, like, okay, they took that variable out by providing meals. But so you see a lot of that even happening in society, pre-made meals or things like the Hungry Route where they send you a box. But even then, as much as I love the idea, we're still shipping food all over the place, we're not fostering the things that don't cost money, like growing your own food
Yeah.
and having some control over what that is. You may love broccoli, I may hate broccoli. Well, then in your plan for food is going to look different than my plan for food. You can get those same nutrients, detoxification inputs, things like that from other foods. So we're kind of off on a tangent here, but it's the point is people will choose what's available to them.
Right.
And
Yeah.
so if the things are not accessible, then the recommendation doesn't really matter.
Yeah. That makes sense. So then where are you at now? You were teaching for, a functional medicine company for a long time, and you talked to thousands of doctors.
Yeah.
And it sounds like the biggest thing you learned was that, the basics matter the most. Like you treat the person and their lifestyle more than first, and then the condition kind of secondarily. But where is that taking you to now? You've done more like social media. You started like a membership that launches once or twice a year, I think.
Yeah. So during my corporate career, I was the quintessential doctor burning the candle at both ends. I would go to work all day and do my corporate job, and I would come home and I would see patients all night, and then I would see them on Saturdays. And it only took a couple of years of that before I realized, you know what? Like, when's the last time I saw my friends? I want to help everybody, but I can't do all of this without being my own patient here. Like, I'm burning myself out and I have to come up with a solution. And I said, I'm going to stop seeing patients, but the phone never stopped ringing. So I was like, what can I offer people that gives them a huge amount of information to make progress that doesn't require me to see them? So I kind of took like 80% of what I would do with my autoimmune patients and made an online course. So the online course is a year, and it goes through everything from diet to blood sugar regulation to which supplements to consider based on your diet. And it's a lot of decision making, right? Because I think that as a perfectionist was part of my issue. Well, how can I possibly disappear? I'm the doctor that knows when the person's in front of me, oh, this is a better route for you because. So I built in a lot of like decision making processes and a lot of experimentation, sort of biohacking type stuff and self-experimentation within the course so that people can see what works for them.
Nice.
And by the end of the course, many of the people are eating the underlying foundations are the same. It's whole foods, it's omnivore, it's nutrient dense, things like that. But they may be eating totally different things because one's an athlete who's 20 and one's 50 years old with a new baby or something. Like, I don't know, so everybody has a different set of criteria. And then that's the foundation for everything. Then they get into the gut microbiome, digestion, all of those kinds of things, into detoxification, liver function, immunity. Then they move into thyroid and hormones. And I don't know if this is a good time to talk about that, but the reason I don't let them worry about that, even though so many people are coming to me with hormone symptoms, the reason I say you're not allowed to worry about that yet is because if you have not corrected blood sugar fluctuations and spikes, if you have not filled the nutrient gaps required for hormone production, if you have not optimized the microbiome and beta-glucuronidase levels, then you're just reabsorbing all of these hormones and toxins that are endocrine disruptors anyway. So there's a lot of work that has to happen for sort of the shiny bullets in the hormone modules to actually even work.
Right.
You can take a hormone class that tells you to take these supplements for these symptoms and things like that. And there's some value there in green medicine, if you will. But if you don't optimize how your body produces hormones, processes hormones, and receives hormones from a messenger's perspective, then you really don't get that far.
Got it.
So it's a year long because it probably takes me at least a year for most people to have their autoimmune disease put into remission. So that's why I built the course. So it just required them to have this sort of tether for a long enough period of time, because that tends to be another issue is, oh, it didn't work in a month. Like, I guess this didn't work. I'll move on to the next doctor's program. And it's like, you need to at some point commit to something. So that still exists. But nice. I had a baby. I unexpectedly had a baby. You know what's funny? This is also a tangent, but that was a very common thing that people would say to me when they found out that I was pregnant. They would look at me and they'd see my belly and they'd be like, congratulations. And in my mind, I'm like, this is like a fate worse than death for me. And I can honestly say that right now. And I was very open about that because
Yeah.
I went into my career. I never had the inkling that I wanted children, that was something I had to do. I know a lot of women feel pulled to that, and I just didn't. And I have a very masculine energy to me, if that's what you want to call it. And I never felt that. I never desired that. And everybody I ever talked to is like, if you don't kind of want it, it'll change your whole life. And I don't know if I would do it if you aren't quite sure, you know? And so
Yeah.
I knew that 40 would be my cutoff. I was like, okay, if it doesn't happen before then, if I don't decide that's what I want, then that's it. Well, then I turned 40 and I was pregnant. I was pregnant. And so many people would be like, congratulations. And they thought I was trying and trying. And this was like
Right.
the moment.
No.
And I just wanted to melt inside, like, oh my, am I the only person that like doesn't desire kids? Now, having said that, we're a little over a year out and I had to step down from my career. It was all the fears that I had that a child in my life would probably mean XYZ things. And that felt negative to me. Like, how am I ever going to keep my career, which requires me to travel 50% of every month and things like that. And I know that your crazy schedule too. I would wake up, I would create content, I would go to work and study and teach and do all these things. There was that period of time where then I was also seeing patients at the back end of the day. But then when it was online education, it was more business content and things like that on that type of platform. And let me tell you, that's not possible with a child.
Not at
It's
all.
not. It's not. So I'm really glad that I had those 40 years to figure out who I was, what I wanted, have all the experiences. I traveled all the time. And now I lost my career and I was worried about that. But I have never been more content,
Mm.
ever.
Wow.
I have never been more fulfilled, ever. I was sort of an achievement hoarder.
Yeah. Gave me goosebumps.
I
Yeah.
was sort of I was sort of an achievement hoarder, and I didn't realize how much ego I had. I wouldn't have considered that part of my ego, but I didn't realize how much of my self-worth and identity I put in being accomplished. And I didn't know what to do when I wasn't able to produce anything or accomplish anything. I no one was there to tell me. I mean, obviously my partner is here to tell me I was doing a good job, but it's not the same as getting on
Yeah.
stage and having people clap for your lecture. It's not the same as your boss telling you did an amazing job or you created this thing and you're getting all this feedback, right? So it was the first probably moment ever in my entire life where it was like, I want to say this as bluntly so people understand what I'm saying, but not in a negative way. I've never been more worthless to the world and needing to figure out what that meant for me, because I then was like, do I even matter anymore? But at the same time, I was someone's whole world now, you know?
Right.
And there's not a lot of feedback that comes from the baby in the early stages, right? You're doing so much. I did not want anything to do with kids in practice. So I, even as a doctor, had to figure out, oh my gosh, okay, what are the pros and cons of this? I have to make a decision about this. I'm telling you, there's probably about 100 decisions you have to make. And if you've never encountered them or lived in that world, it takes a lot of time to research. You're breastfeeding every couple hours. You're, doing all of these things for something that doesn't really participate back.
Mm-hmm.
And you're doing it alone. Like, people got to go to work. Life goes on, right? And we don't live in villages anymore. Like when I lived in Africa, they were like little communes. So they were polygamous, but that's beyond the point. They had like a communal area and the mothers lived with the grandmothers, lived with the children. And if mom needed to do something, there were 5 other people there that can watch the kid, right?
Nice.
So the village isn't really there in the same capacity as it is in other cultures, but I can very, very clearly say that I've never been more sure that anything was right in my entire life. And if you had seen me when I was pregnant, people were like, she's not going to survive this. Like, this is not going to be good for Angela. It's going to change everything. And it did. And it changed everything that I was worried about it changing. And I'm so glad that it did. Yeah. So right now I have all the online stuff still going, and I love it in the sense that it's how I can still deliver life-changing information to people and walk them through things. But I'll have to figure out what next steps are once we have a little bit more time freed up to get back to career. I was listening to a podcast recently, actually, from 2 women that were in menopause, and they were saying how great menopause is because they've moved out of needing so much time for family back into what can we do for the world that our grandkids are going to grow up in and our children now are adults in and things like that. And it's almost like you have the time again. So I'm trying to remind myself that even though right now I'm like, am I even going to go back to work? Like, what does this even look like? That there will be a time when I don't have a small child that I can really do deep thinking again and put a lot of time into something, and we'll see what that ends up being.
Yeah, definitely. It's really changed you a lot, it seems. And like sometimes they say, I feel like the best thing for you is on the other side of what you fear the most. And it really came hard and fast for you.
Yes. And once I went through the stripping of everything that was my identity and being like, what am I worth anymore? I think you see this in other things too. So like if you've ever seen like The Biggest Loser, you notice that they have a lot of professional athletes that go through that show. I don't think it airs anymore, but there would be a lot of professional athletes that were at the top of their game, and then they're on the show for being morbidly obese. And it was an identity strip. When someone rests so much of their identity in things that they could lose, then once you lose them, they no longer know who they are. And that is catastrophic for most people, because then that's where worthlessness, depression, coping mechanisms come in and things like that. So I don't know if I had had children earlier. I don't know if I would have gone through the same thing, because I didn't have 40 years to build a career and develop that identity, right? But I also don't know if I'm secure enough in who I am to understand what I was going through, to know kind of what I needed to center myself again, and that it was going to be a passing phase. But it was definitely tough. And I think, I don't know how old you are, but if you choose to have children later in life, I think that is one of the downfalls, is you've created such a life that you want and such an identity for yourself that it becomes like, what if these things don't exist anymore? But this happens all the time. What if you lose your job and you're no longer,
right,
whoever that person was? If you get divorced, all of a sudden you're no longer this person's partner in your friend circle and things like that. So I think we see that in microscopic ways. They don't always have to be so large, but it was the first time I think I've ever had just everything just dissolve.
Yeah. And I think having a child around 40 or later ends up being very similar to the perimenopause issues. It's like you're kind of getting into hormonal changes, thyroid, adrenal, dependency more than before. But I'm wondering, like, how did that affect you, or what do you see in your patients you've had over the years too, with like, 40s and changing hormones and trying to stay healthy? Like, what are the key takeaways there?
I'm very glad that I went into pregnancy with the lifestyle that I had, because it's very common for people to end up with a disease or diagnosis or end up being pregnant and then they go, oh, what should I be doing to optimize my health in this moment? And all of a sudden, just like me trying to navigate 5 million kid decisions that I've never encountered before, it's overwhelming, right? So
Yep.
I already knew how to cook healthy, eat healthy, right? And so I went in, I think fertility is often seen as a sign of health because it is a biological
Mm.
necessity for a species to exist, right? Now, I'm not saying that that means any shame or fault when someone struggles with that, but I do think that it is a reflection of balanced and optimized hormones within someone's system. Okay.
Right.
Now, I never had irregular cycles, so I went in probably as hormonally optimal as I could have been. And then getting pregnant is part of that. And I was worried, like, okay, I'm in perimenopause likely. So if you're over 37 and you've got some combination, I would say a trio of symptoms, for most women, it's like weight gain that they didn't change anything about their diet or exercise, but all of a sudden they kind of gained 5 to 10 pounds. They're waking up at 2 or 3 in the morning because their
Mm.
loss of progesterone. So insomnia sometimes is a big deal. They may be experiencing hot flashes in the middle of those same nights, although that's not, in my opinion, one of the earlier ones, although that's one of the more annoying ones for most people when they start experiencing them. Mood, so anxiety or depression will pop
Mm.
up when it never existed before. Or I would say cycle changes are another one. But that, again, in today's world, when so many people don't have regular cycles or they're on birth control that is giving them a fake cycle, it's hard to spot. But if all of a sudden you're having super heavy periods or really long cycles, or your cycle all of a sudden shortens to like 27 days and it was never that way before. If you have some combination of those and you're over 37, you likely are in perimenopause. I am in that age, but I didn't really have any of the hormone fluctuations that I was experiencing yet. I feel like people call it the second puberty because it's the second time a woman has high estrogen levels and lower progesterone levels.
Mm.
And so the same reason teenage girls will have heavy periods and skin issues and things like that are the same reason you see them popping up in people in their 40s and they're like, I thought I was over my teenage years, right? So
Got
I
it.
didn't know, what was going to happen, but I knew, let's track my hormones. Let's make sure that my blood sugar is staying stable during pregnancy, all of these kinds of things. And I was very lucky. I prepared myself for the most dramatic drop in all of women's hormones is after they have a baby. And that's where postpartum depression can come in, postpartum anxiety,
Right.
etc. So this is where I like to stock like a green medicine sort of cabinet, because
Mm.
you're going to need support when you need it. And the last thing you need to do is be ordering things that you have to wait a week for and trying to figure out, whatever. So I already, before I gave birth, had like, okay, if I happen to get postpartum anxiety, what things do I need on hand? If I think that there's a chance, which there is always a chance, that you might have postpartum depression because of this drop in hormones, what do you need on hand? So I sort of built my little medicine cabinet to be there as a rescue in case any of those things happened to me. I didn't end up having that. I did have fluctuations in thyroid.
Mm.
But again, if you go into perimenopause, or if you have these things happen in pregnancy. So let's say you had a kid at 25 and you had severe postpartum depression or a lot of like insomnia issues, hair loss. I mean, hair loss is a part of the process because any type of trauma, you're going to see some hair loss, but hair loss, lots of times that's connected to iron and thyroid and things like that, cortisol. If you have had that stuff as a non-perimenopausal person in pregnancy, watch out because those things will come back in your perimenopause years.
Mm.
So I would say it's more common now that women who are getting higher education degrees and waiting to get married and things like that are having children in older years. So you might see this like, oh, now I'm in perimenopause going through hormone fluctuations. I may be struggling with fertility because of that. But if you're of the generation that chose to have kids prior to your late 30s, know that whatever your experience was in that hormonal drop, you will see those things, same things pop up in perimenopause with that hormone drop if you don't sort of get things in order. And even then, it's somewhat normal. So this is where we come back to the questions. Because right now, I don't know about your algorithm, but my algorithm is feeding me everything there is about hormone replacement therapy and menopause and how everyone should basically be on hormone replacement therapy. And while I'm not anti-hormone replacement therapy, I sort of have a rung of things that we've got to go through, right? Some level before we get there. Now, it can be a therapeutic intervention to rescue someone in a moment, but lifestyle is always going to be the foundation. Even if you take synthetic hormones, your body's not going to, process them and get rid of them the way that it needs to if you haven't optimized your microbiome, your liver function, etc. If you take hormones and haven't done any of the work, it's going to show up. Okay. But lifestyle is the foundation. And then I usually jump to herbs. Like, what can we use in the plant kingdom that has an influence on your own body's hormone production? So what I did before I got pregnant, I did not know I was going to get pregnant, but I was turning 40 and I knew, okay, I still feel great. And everything about my body composition, my brain function, everything is functioning optimally. So I went and got my hormones tested because every individual has a different hormone panel that's right for them. So when my hormones start dipping, or I might decide because I'm ApoE44, which gives me a very high risk for Alzheimer's formation, and there's that window in perimenopause where hormone replacement therapy may actually be very, very therapeutic for those that have a risk of dementia. So I thought, if I'm going to go down that road, I want to know what optimal is in my body when I feel optimal, so that when we go to replace hormones, I know what my targets are. We can give ranges like, most women feel the best when their estrogen is here or their progesterone is here, but that's not the case for everyone. So honestly,
so you're doing blood work to find it?
So I did blood work before I felt like I had hormone issues. Obviously I got pregnant then. So now and I'm breastfeeding. So that puts you in like a pseudo menopause. Breastfeeding does. So I'll get them tested again. I'll be interested to see, because you have another hormone change after you're done breastfeeding. So prolactin levels have a lot to do with that. And sometimes people will have worse post breastfeeding depression than postpartum, like birth depression. So I'll keep you informed on how that goes. But I think it's important for women, if there's ever a moment in time, I mean, obviously that's your hormones are going to change, but if there is a moment in time when you feel your best, get a panel done, which is counterintuitive. We get the panels done when we feel like crap.
Yep.
Get the panel done when you feel good. And when you do that on enough patients, you realize, wow, some of these patients have hormone panels that if I would have run this and they told me they were feeling like crap, I would have been like, yeah, I can see why. But this person actually feels great. This panel feels normal for them, which is an odd way to look at it. And there are some inherent things where it's like, hey, if your estrogen levels are just so many times higher than your progesterone, there's a very high likelihood that we're going to see symptoms and you're not going to feel normal and whatever. But there's a ton of unique individuality that goes into hormone panels. And I always come from the question of like, what would nature do? Before hormone replacement therapy existed, before, all of these modern technologies existed, what would we have done? And I think this transition from your fertile years into menopause, which it's about a 7 to 10 year transition. I would say 7 is usually what most people will cite, is normal. When people are going through puberty, we may give them things for their symptoms, but we don't say you have a disease.
Right.
Like you're becoming.
Perimenopause is not a disease.
Correct. And neither is menopause, right?
Right.
Now, does that mean someone has to suffer going through it? No, but it does mean things are changing. And I do think it's interesting to note that there's only 2 mammals on the planet that outlive their fertility. Do you know what the other one is besides humans?
No clue.
Whales.
Oh, I was gonna say whales. That was crazy. Okay, sorry.
And we have no idea why. We have no idea why, but they
Huh.
they believe that it's because we're social beings and there's value in what that life experience has been and the village that it creates for the young, because our young are so reliant on us for such a long period of time too. So it's like these women need to be here. They play a very integral role in passing down knowledge to the women who are having and bearing children, to the support system in which they're raising their children and things like that. But we can't have them competing for the fertility.
Right.
You see what I'm saying?
Yep.
So I think that we as a society, I mean, it's no secret, have glamorized youth. And that's why any bit of aging is a disease and we need to reverse it. And if I happen to get a wrinkle or a gray hair, I am proud to say that these grays are mine and they're all mine. And I am human like everyone else. And I do have moments. I've already been mistaken for grandma to my baby, so it's okay. But I have my moments like that where I'm like, oh, maybe I should dye my hair, or maybe I should try to look a little bit younger because it's a little bit weird that I'm this old with a baby or whatever. But then I think to myself, like, I only feel as comfortable being me in whatever that is when I see other people being comfortable in whatever that is that they are. Because when you see people changing things about themselves a lot, we often don't judge them for doing it to themselves. What we do see though is, wow, they thought their hair looked so bad that they had to dye it. What do they think of mine? So it's almost like we see other people do things that make us feel like they're judging our version of that. Like, oh, they can't have any wrinkles. They have to get Botox. So do they see my wrinkles and think, oh, she should get a little, touch up here and there or whatever. But the moment you see someone who's like aging gracefully and happy and is like, I am fine with this natural process, it does give people permission. And I don't want to say that I have any more influence on anybody or any more reason to be a certain kind of person than anyone else. But I think to whom much is given, much is, expected. I feel like my platform, I have a lot of women that follow me that are on the fence about whether or not they should participate in some of the things that quote unquote reverse their aging.
Right.
And I don't need to be an example for anybody, but for me, because I know there's a lot of doctors that may not share this thought, but for me, it feels more authentic to be me and be telling these people that these things are normal and that we can embrace some of them in a very healthy communal way. And it doesn't feel like I'm preaching something that then I'm not taking my own advice. I feel like there's a lot of women who behind the scenes come to me and they say, I love XYZ doctor, online, but it's hard for me to listen to them because they're doing all these things that don't show that they actually embrace or think this is normal or whatever, right? I don't know if
Right.
I'm articulating that.
No, totally.
So
I mean, a lot of
appropriately,
people are
but
getting like injections, facelifts, dyeing their hair, like all different kinds of things, hormone replacement therapy or pellet injections. I think there's just a lot of
and to
things that
some
people are
extent,
doing.
everybody has that choice. And I'm not
Yeah.
judging anyone for choosing those things, but I do think with that choice, others view it as you seeing those things as negative. So then if they
Right.
happen to have some of those things happening for themselves, it almost is reflected as a judgment on them, even
Yeah.
though, you're like, hey, I'm just doing it for myself. This has nothing to do with you, right? So I understand the chase for youth, but I
Right.
also want to be an example of living a healthy lifestyle and what normal can look like. We don't have very many normal examples. Like we have a
No.
lot of artificially injected, no pun intended, examples,
Yeah,
and we don't know what's normal anymore or what's healthy.
for
Like,
sure.
oh,
Yeah.
I'm
Or
going through
what
perimenopause.
it's like, what if you, like your instance, if you did have a healthy lifestyle, you also might not
Mhm.
like, need to do as many interventions in order to feel or appear healthy. But
Right.
that's much harder for people to grasp or comprehend or want to take responsibility for, I think.
Yeah. And um, I think too, like, okay, so let's take some common symptoms of perimenopause that would be normal, like the 5 to 10 pound weight gain. You have
Yep.
no idea how many women sat across from me, and I am not a hormone expert and never did, but I always had to play in the sandbox because autoimmunity is linked to hormones, which is why women get them more commonly, which is why the most common one is Hashimoto's, which is due to the hormone fluctuation that impacts the thyroid after someone has a baby most of the time. So there is an interplay there, right? And many women would be in their late 40s, early 50s telling me, I need to lose weight. Can you put me on a weight loss program, or can you give me a diet or whatever? And oftentimes I would ask them, what is the ideal weight for you? And they would give me a number. And I would say, when's the last time you weighed that? Almost always. It was like high school. And so there's this idea that they're chasing something that they want back, quote unquote. But the reality is our physiology may not support that. You may actually need a higher body fat percentage, as crazy as that sounds, in your older years. And we actually do not know why this is either, but some hormone experts suggest that adipose tissue creates estrogen. So when your ovarian production decreases, and we know estrogen, which estrone is what you're producing later, is protective for your cardiovascular system, your brain, your bones, etc. Like, how are you going to get that estrogen if you're not taking hormone replacement therapy? There was a point in time where hormone replacement therapy didn't exist. We didn't have doctors writing prescriptions in
Right.
evolutionary times. So that is one theory too, that you gain a little bit of weight, especially if you were a extremely thin build before, so that you have adipose tissue helping the hormone production necessary for the healthy elements of menopause and older transitions. Now, there's tons of things we'll never know the answers to, but I do think that nature is smarter than we are.
Yep.
So I try to just remind people what is congruent with just human. If you just look at us like any other animal and not like a separate type of being, like what would be normal for this species? What would be considered healthy for this species? Like, what
Yep.
are the health requirements, the inputs for this species? And it always comes down to diet, movement, stress, da da da. I would have told you that I was very happy accomplishing things in my career and producing, just cranking along. But I'll tell you, after I got over the shock of self-worth questioning,
Yep.
now that I don't have work driving me, my cortisol panels must just be like heavenly, which plays into hormones. If you are
Yep.
stressed, I've been thinking a lot about this. If you are so stressed, you have this triangle of interplay between your thyroid, your sex hormones, and your stress hormones. And we always cover stress hormones in the online course before we do sex hormones, because if you're stressed, you are not going to be able to produce sex hormones the way that you need to. So I was thinking about this. Why is life so stressful? I've always said that the more responsibility you add to the plate, the more stress you will have. Okay, the more things you have to manage, which that's the idea of minimalism, right? Get rid of things you have to manage so that you can clear your brain of having to stress about things. But I started thinking about the 24-hour day. Like we all have 24 hours. That's it. Like nobody is equipped with more than that. And you're supposed to sleep 8, maybe 9, depending on who you listen to. Maybe you can get away with 7. Okay. So let's take that chunk of time out. Let's give yourself an hour to like get ready for bed, get up, do those kinds of things. So you're looking at like a 9-hour chunk of that 24-hour day is your sleep requirement.
Yep.
For healing, for hormone production, for brain detoxification, for you to feel vibrant. Okay. How many people do that?
Very few.
Then, you put commuting times on top of it, meal consumption. Do you prepare a meal, sit down and chew your meal, have a meal with people? Because that is also part of the requirements. Let's just say 2.5 hours. If you have 3 meals, let's just say 2.5 hours out of your day. There's another 2.5-hour chunk. An hour, let's say an half hour commuting each way. There's an hour just to and from work. You need to exercise. If you don't have a job that puts movement in your day, then all of a sudden we have another section of time that has to be a requirement. So now you either, let's say you're at home and you don't have a commute, but usually you're going to the gym. So there's a commute and then you have another hour chunk gone. But this big chunk outside of sleep is work. Commuting to work, working, coming home from work. And I did the math. If you meet all of the requirements, if you have a normal job and you meet all of the requirements, bare minimum for your sleep, eating patterns, movement, things like that, connecting with people, you have 1 hour. 1 hour. Are you going to walk the dog? Are you going to clean the house? Are you going to read a book? Are you going to do something that brings you joy? Because joy actually enhances hormone production. That's why a lot of hormone experts will tell you to have more orgasms. I know that's kind of maybe on the edges here of what we need to be talking about, but the idea of like oxytocin and joy and feeling good actually changes whether or not your probiotics work.
Wow.
They've done this. They've administered probiotics within people who have like robust oxytocin levels. So you can give people hugs. You can pet your pet. You can be in love. Like there's so many things that you can do having a baby and skin to skin. That's why we do the skin to skin. But if we never do anything that elicits that, it's all just like, I got to do this. What's the next thing? I got to do this. Then your supplements may not even work. Like that's how insane it is. So
wow.
I feel like now that my job is stripped and I've gotten over the ego thing, I've also realized that I was stressed. I was stressed. And I don't know how to change that for people because so much necessary work is required in this society to pay your bills, to pay for childcare, which has like gone through the roof. So, I don't know how to remedy that part for people.
So is it like
I can see
the
why
secret
they on their phone?
I mean, Joe Dispenza always says people get addicted to the hormones of stress and work, but maybe it's the solution is just everybody's got to get pregnant. No, just kidding. Or do Joe Dispenza find a way to like slow down somehow or like find more joy in their lives with or without kids? Clearly,
I wish that like corporate positions were 4 hours a day. I actually think people would work better. They would be able to be in deep thought when they're actually working because it's not an all-day thing. You're not killing your time running to talk to so-and-so because you need a little break and, whatever. You would have 4 really good hours to produce things and be at your best. But then you would also have the time to be your best. Yep. I've often said, especially when we were going through hiring cycles, I can't ask people these questions from an HR perspective, but I want to hire the healthiest person because that person's not taking sick days. That person is happy when they come to work. That person, like, it changes everything. Your health
Yes.
is the tool then that changes everything. Your ability to concentrate, your ability to have executive function. Like I think that, but I can't change that. I can't change that for people. I can't say, hey, you got to work a part-time job. I can't tell everyone in corporate America that 8 hours is too much. But I think that when we all went to remote work with COVID, we realized that even the minute hour that you got from commuting bought you enough time to get your laundry done and do a workout, or whatever the case may be. And all of a sudden you actually had time. I know that there's a lot of like hardliners that are like, if you say you don't have time, then it's just not a priority. But the reality is let's break down the 24-hour time pie. If
Yep.
we prioritize sleep, we end up taking from the pieces of the pie that will not hold us accountable for that. We won't take it from the 8-hour workday because we'll get fired.
Right. Yep.
So we take it from sleep. We take it from meal preparation. We take it from
Yep.
exercise or the commute to the gym. We take it from all the things that we know we need. And I truly believe, and this is all, the time pie is all without a kid. Add a kid in there. Now you have school pickups and sports and whatever. And I've never been one where I actually think some of the feminist ideas around gender equality sort of put us in this position. I was a career woman. I want every woman that wants a career to have a career. But when you try to do it all, we only have 24 hours. So from a health perspective, if we're looking through a functional medicine lens of chronic disease reversal, optimal hormone function, fertility, all of these things, I'm going to tell you to pay yourself first in sleep, food, whatever. Then at the end of that, what do you have left over? That's what you can decide to do with your time. And there's just not
Right.
8 hours. If you like,
Right.
I don't know how people are going to do it.
I know. And for people listening, I think that's how you have a healthier perimenopause or menopause, is by getting your day right, which is your lifestyle, which is all the things that lead to healthy sex hormones and adrenal, thyroid, HPA axis, like all of the hormonal systems in your body that are shifting. It's all about what does your life look like, really.
Right. And I have dealt more with women than men. You do see decreased testosterone levels happening in men as a result of stress, but I do think they tend to be more resilient to stress. And so it does make me wonder, like, is there a reason then why there was this gender role? I think in some ways it suppressed women, to be at home and be totally reliant on a man. But, did that serve women and their fertility and their hormones on just a biological species evolutionary level to not have the additional stress that comes with sort of the masculine energy of performing and creating and constantly, showing up to do more? Because you could actually bond with your children and get things done without a timeline. So we went to the zoo this morning, and this is very low stress, but I had to be there at a certain time because the stroller tour started at 9. Well,
Okay.
up until this point, I have not had to do that. I have not had to be somewhere at a certain time. I realized why women get stressed on their way out the door. Because now you have a child that doesn't adhere to, they want to explore, they want to play, they want to do stuff. And you're like, we got 10 minutes. Oh no, you just threw this thing all over and now I got to pick this up. And now I'm stressed. And people are like, I can't believe you're like so relaxed in motherhood. And I think that's part of it too. I have nowhere to be. It rained the other day and I was like, we can't go outside, buddy. It's raining. And I was like, but you know what? Why can't we? Normally I would say that because I have to be somewhere else, which means that my hair can't be drenched. It would be inconvenient for work, life, or whatever time. And I was like, okay, I don't have anywhere to be and it doesn't matter if I'm wet. Let's go outside. And we played in the rain. And I'm like, okay, like I have nowhere to be at a particular time, which allows me to not be stressed when he wants to explore, to not feel like I'm under the gun and we don't have time for this. So I'm not saying that we have to revert back to suppressing women if that's how we view gender roles or whatever, but from my own experience, it's been an interesting thing as a career woman who's been like, I am a woman, hear me roar, and I can do anything for myself and everything for myself, to being one that is at home now with a child, and how that has decreased my stress levels, even with like a baby. When most people are
Yeah.
stressed, I think some of that comes down to, oh God, we gotta be here at this time. You just puked on me. Like, your whole day is shot already before 8
Yeah.
a.m. So I don't know. It's a lot of interesting ideas and questions, and I'm sure there's some people that will hate that thought, but it's been one that I think has served me. Having
Yeah.
lower stress levels and less obligations has
Mm-hmm.
probably served me. I had no postpartum depression, no postpartum issues. My period came back around 10 months of breastfeeding. I'm still breastfeeding, but everything went back like clockwork. I was like, am I going to like skip one and it's going to be kind of like unpredictable? No. So I see that as a very good thing. I think women that are going into it as foundationally set as they can will experience that more than those who don't. But you and I and everyone else have all the answers available to them if they choose to embark on the journey of lifestyle
I,
interventions and avoiding endocrine disruptors too. That's another
right.
huge part of it.
And
You know?
speaking of answers and questions, I got 3 short questions, I
Yeah.
guess. We can do like quick hot
Sure.
takes since we're running out of time
Okay.
here.
Yep.
One of them, the first real quick one is, um, does, well, no, I'll skip that one. I'm going to ask, what tends to cause hot flashes?
Low estrogen.
Easy. Okay, done. Second
Yeah.
one is, what was in your medicine cabinet that you had for after birth? Because you said you had
So I
things
had
ready to
St.
go.
John's wort. I had St. John's wort. I had motherwort. I had passion flower, because the St. John's wort's going to give me just a little bit of sleep, depression help if I need it. The passion flower, same thing, sleep, anxiety a little bit. And motherwort is really good for balancing hormones, just in general after pregnancy, or for any women actually, to be honest. But I would say if I was talking to someone who didn't have babies, this is not a short answer, someone who didn't have babies, I would say that Vitex or chasteberry is probably the most balancing herb that we have for perimenopause type symptoms and hormone balances, because it supports your body's own progesterone production. But it's not necessarily completely safe in breastfeeding. So it's not one that was a whole nother thing. I had to figure out which things can I use as a breastfeeding person, and they're not the same as those that aren't breastfeeding. But those, I would say, were my big 3. I also had magnesium.
Got it.
That's a good catch-all, not only for any, I didn't end up having constipation issues, but many women do, or anxiety or sleep issues. Magnesium's a good sort
Nice.
of like.
So you didn't do the placental encapsulations trend?
I did.
Consider. Oh, okay.
I did encapsulate my placenta, and I read a lot of research on it, and I did not think there was a downside to it in any way that was going to outweigh the potential upside.
Yep.
I have tons of women that say that it was a lifesaver if they had one pregnancy without and one with, in terms of their mood post pregnancy. And I don't know whether or not that is because of hormones present in the placental encapsulated, or if it's because of the nutrient density, because it's an organ just like anything else. So if someone didn't want to do that, I would say at minimum do like liver or something like that, that has a lot of the fat soluble vitamins, iron,
Yeah.
all the things that you need to restore normal function, could be just as beneficial. I don't
Nice.
know how much hormones play in that.
Got it. And the last question is, if, you know, comes like 10, 20, 50 years from now, whatever your time on earth is nearing its end, what's like one big message you would want to leave to your child or to your patients, your community, your partner? Like, what's one message you would want everybody to remember?
That they're here for a reason, and to leave this earth better than when you found it. That's always been sort of my ethos. And I think that that opens the door for it to be anybody's gift that they have. And it doesn't have to be big, is needed and worthy, and energy cannot be destroyed or created. We're here and we're all contributing. And whatever it is that you have to give that makes it better is worthwhile.
Beautiful. All right. So how can people find you and learn more about how to have hair like yours?
Oh, I know, right? Like, oh my gosh, I haven't even washed my hair in 2 days. Don't tell anyone. So
I know
on
it's like
Instagram,
you
I
told me a
got
long time ago. That's the most common question that you get. It's like, what do you do for your hair? And I think you have a story highlight on Instagram. But
I had to create a story highlight just for my hair.
yeah.
But no, it's Dr. Angela Lucterhand is my handle. And on there, I've got links to any of my online programs, tons of protocols listed. We didn't have a chance to talk about your membership at all, but we do start another cohort of the online course in July. And I think what's different, if I could, you tell me if I'm right or wrong, about like the way my course works versus like a membership, is it's a live cohort. We start together at the same place and we're all doing the same things with each other. So you're all asking questions about the same things as you progress. And I used to use sort of like my blog and whatnot as kind of like your membership, where it's like there's tons of information to delve into wherever you're at. And I do get some people that are like, can I just jump to hormones? And I'm like, that's Dr. Brad's membership. Just go
learn
get
about
the
it.
library of things. Go get your, yes, you're going to learn about it later. We're going to do things, but I'm not teaching functional medicine in the group. And so there are people that just want to learn all these things about functional medicine. I'm really more about how can we implement the changes you need successfully for you, which are pretty much lifestyle changes. But we do it together and we all start on the same date and that sort of thing. So
very cool. Yeah. I mean, it's nice because then they have a group of people they can learn with and from.
Yes. Yep.
Excellent.
And you often find there's a lot of people in the same season of life, and community is important. People have to feel like someone else is going through things that I'm going through. And when you see success, you believe success is possible.
Yeah. Love it. Well, thank you so much for sharing your time with us all. And I believe time is one of the most precious things we have, other than those we love. And so I really appreciate your refreshing take on hormones, perimenopause, menopause, and just telling people what the truth is, not what the fad diet of the month is. It's great.
I know. I'm sorry.
Thank you. Sorry for the truth. It hurts, but it's real.
Yeah, don't shoot the messenger, but you still have more control than anybody else of your own inputs. Yeah.
Boom. Mic drop.